Cape Fear Business Roundtable is sponsored by two branding partners located under one roof right here in southeastern North Carolina. Pioneer Strategies is a strategic communication firm focused on helping you build success through effective strategic communication. Pioneer Specialties is your promotional products partner, ready to help you through the entire process from product research through product delivery. For more information about our sponsors, visit capefearbusiness.com. Welcome to Cape Fear Business Roundtable. I'm your host, Frank Williams, and today our guest is Dr. Paul Hrvol of Coastal Integrative Chiropractic, who also happens to be my chiropractor. I saw him this morning and am feeling better because of it. So, Dr. Paul, welcome. Thank you for joining us.
Yeah, thank you for having me.
And well, I like to start out before we talk about business and what you do, just to get into some personal background. And obviously, we live in a place that has a lot of growth happening, a lot of new people moving in. So tell us where you're originally from, and if you're not from here, how you ended up in this area.
Yeah, so I'm from a teeny tiny town in Illinois, Sullivan, Illinois. Grew up there, 2 stoplights, moved to St. Louis for college, and all our whole lives we grew up going to the Outer Banks, and then I started coming out to Wrightsville and decided, hey, I want to move out to North Carolina. And fell in love with the Wilmington area, and just like most people wanted to get away from cold weather and get some sunshine and beach time, so that's how I ended up out here.
Well, tell us, when you're not working, which I know you like to work, but when you're not working, what are your favorite either things to do or places to go in this part of the state?
Oh, love going to the beach, love playing golf, wish I got to play more. But then we spend a lot of our free time down in Southport, just hanging out by the water, going to the restaurants and stuff like that.
There are definitely some nice restaurants in Southport.
Yeah.
You know, the water down there is just beautiful. It's one of my favorite little corners of paradise.
Yeah, we got married right down there on the water, so.
I got engaged on the waterfront down there, so.
There you go.
Similar experience.
Yep.
Well, to switch gears and get into work, tell us a little bit about your career journey and, you know, what led you to being in the chiropractic profession and how you ended up here.
Yeah, so I always thought I wanted to do something healthcare related. Always grew up thinking I was going to go like the traditional medicine route that a lot of people think of. Got all the way through college, was studying for the MCAT exams, and I worked in a hospital for a year, between my junior and senior year of college, and that was not the environment for me to be in at all. And I played baseball all through college, and we had team chiropractors, so I'd been adjusted by them, and I shadowed them in their offices, and I was like, this fits me a lot better. I also, when I was in the hospital, I dreaded going in every day. Once I got into this side of healthcare, it was more exciting. No day is the same. Just a lot different approach, and went this route. And it was convenient that I was living in St. Louis, playing in St. Louis, and then our team chiropractors were at Logan University, which is where I then went to chiropractic school. So it all kind of just aligned and worked out that way.
You almost did a play on words there. You said it aligned.
Yeah, I should have said pun intended.
And you know, and I think that's interesting. You know, I thought I wanted to be a computer engineer when I went to college, and then I co-opted a couple of semesters working in a computer-related environment, and I realized that there were parts of it I enjoyed as a hobby, but I absolutely did not want to do it for a living, and that was it. Not what I dreaded going to the place that I co-opted, and they were nice people. I just did not like what I was doing, so I'm so glad I had the opportunity to experience that before I finished my degree in that and was able to change courses before I wasted a bunch of money on a degree I didn't want to use.
Right, for sure. I mean, you're doing it for a long time. You got to enjoy it, right?
Exactly, 100%. Well, tell us about Coastal Integrative Healthcare and you know what you guys do. Obviously, I know there's the chiropractic side, but you guys do more than that as well. And what you do and who you typically work with and what kind of things you guys do for them.
Yeah, so with our office setup, both practices that we have, we can treat pretty much any type of patient, and we have a very wide range of patients that come in because we offer chiropractic, physical therapy, massage therapy. We currently have the stretch zone in our office for people as well. And then we do some sports performance training. So we've worked with some youth baseball players that have arm issues. And then I work with a lot of golfers and getting them back out on the course and ideally playing pain free, but keeping them out there and keeping them as healthy as possible. And right now, with pickleball being the craze, keeping people on the pickleball courts too. So it's really nice having the combination of all the different services under one roof.
And you guys have obviously the location in Leland that I patronize, and also one in Charlotte. Is that correct?
Yes, sir. The one in Charlotte is the original office.
Okay.
So we've been in Leland for about 7 years now.
And you mentioned, when you decided not to go the traditional medical route, but to pursue chiropractic, obviously there was something about it that set it apart. So what do you love about what you do? What makes this the right fit for you?
It's with my sports background, I kind of approach chiropractic, the treatment side of it. It's kind of an athletic thing. So like I'm using my body all day. I'm up, I'm not stuck behind a desk.
Right.
Even the actual treatments can be an athletic movement of sorts. So I'm getting to move around all day. Plus helping people heal their body naturally without needing a ton of medical intervention, helping them move better, get more flexible, and actually perform better in even just day-to-day life. That definitely aligns with me a lot better.
And I think having the physical therapy aspect under the same roof is probably helpful as well, And I got introduced to chiropractic probably 20-some years ago when I lived in Raleigh, and I had just switched from a desktop computer to a laptop. And I was hunched over like this. And
sitting way too close.
After about 6 months, my neck started hurting so bad I literally threw up. I had no idea what was going on, but there was a chiropractor who was a member of the Raleigh JCs, which I was a member of, and her office was maybe 2 stoplights from the townhome I was living in Raleigh at that point. So I called her and got on her calendar, and she was able to help. Took a while, but to get me back into the shape that I needed to be in, and where I wasn't constantly in agony. And so I became a believer in it then. And and they're not all chiropractors are created equal either. And that's one thing, you've done a great job, and I appreciate that. But I went to another chiropractor with a neck issue a few years ago, and they just weren't able to fix it. And this was, I think, before you opened up. So I drove back to Raleigh and went to my original one, and she fixed it.
Yeah, it's definitely a field too where everyone's approach is a little different. Everyone's specialty is a little different. Everyone's good at different things. So each provider is definitely an individual, that's for sure. And then certain patients align better with certain providers, right. And yeah.
And tell us about your technique. I know there are probably different techniques as well. The one that I went to in Raleigh was similar to yours, but also different. I cannot remember what the name of the technique she used was, but some people have this perception that the chiropractor is going to come close to breaking your neck when they adjust you, and that's obviously not the case. So tell us about your technique and how it's not what that stereotype is.
So I was very adamant when I was in school about not getting pigeonholed into doing it one way and one way only. So I never really have back-to-back appointments with people where I'm adjusting them exactly the same. Like the way I adjust you is different than the person that comes in after you. So I always start with just open discussion of, have they seen a chiropractor before? Right. What techniques have worked for them? And what don't they like? So like you said, a lot of people, they don't want their neck cracked. They don't want to hear any noise, and that's totally fine. And that's where things like the activator, which is the instrument adjusting, the drop table where you're using more of the table to help set the joints better, comes into play more than the manual manipulation does. I have just as many patients where we do all manual manipulation, but it's all patient specific. One thing does not work for everybody. So when I was going through classes and everything, I took as many electives as I could to not get stuck in one approach, to be able to adapt for every person that comes in. Because I've had my youngest patient, I had a 4-month-old. My oldest patient, I've had a 97-year-old.
Wow.
And everything in between. So
and those two will definitely be different.
Very much so.
And I think that's important because you don't want to go in and feel like you're at a cookie cutter factory establishment. Right. And I think especially when you're dealing with somebody's spinal cord, you need to know that person and know what their preferences are. You don't want them to come out terrified.
Right, and I'm big on how I guess we could say the neurological side of it. How does the brain perceive whatever's happening to the body?
Right.
So even though, yeah, could you do manual manipulation and make 99% of people better? Probably so. But if you have some of those people that in their head, they're like, no, this is bad. I don't want this to happen. It's not going to help them heal because their brain's going to be like, this is a threat to me and I'm going to fight this. Versus if you can do an easier technique where they're more comfortable with, they're going to get better just from that aspect alone.
And I think that makes perfect sense.
Yeah.
Was there anything else about your practice that you want people to know before we move on to a couple of other topics?
Probably the biggest thing, and it's chiropractic and physical therapy alone. Like chiropractic, it's not just spines. It can be, I've got 5 or 6 cases of foot and ankle injuries right now. Some elbow issues, especially with
Right.
golfers, like golfer's elbow. And then like physical therapy too. It's not just surgical. Some people come in, one, before they're having surgery to be better off going into it. Or two, they just, they're aging. They don't feel as good out on the golf course or the pickleball court, and they just want to move better. And that's where being proactive with care, chiropractic, physical therapy, massage, any of it, it doesn't have to just react to an injury. It can just be to be better on a day-to-day.
And to that point, one thing that I don't mind sharing this that you'd work on with me. For years, I had a constant pop in my jaw, and you've been able to adjust that to where it's not. It very rarely does it. It'll still occasionally do it, but it's not the constant thing that I was dealing with that I thought I would have the rest of my life. And I think that's critical. And then a few years ago, my knee just started hurting. Got on an airplane, it was fine. When I got off of the plane 3 hours later, I could barely open my leg. And was at a trade show hobbling around for 3 days, barely able to move. And physical therapy is what helped me get back on the right path.
Yeah.
I didn't have surgery, but that physical therapy certainly helped me get those muscles back to where that knee was where it quit killing me, and I was able to actually function again.
Yeah, I like to tell people, like, I have the surgery conversation every day with somebody at some point. It is rare that they're going to tell you no for a surgery. You can always get that. So try all the conservative measures under the moon. And if they fail, you can always go get that surgery. But once that's done, you're not undoing that and then trying the conservative stuff all over again.
And I think that makes perfect sense.
Yeah.
Well, changing gears a little bit, I know you've been very involved in the community since you moved here. I think that's how I met you. So tell us about some of the things you do in the community and why that's important to you.
Yeah, so I'm on the North Brunswick Chamber Board currently. I'm on the board of the Novant Brunswick Hospital.
Okay.
I was in BNI here in the Leland community for the first few years that we even started the group, and just being out and about. And really, it's investing in the community. Like, I grew up in a small town, so relationships are what mattered.
Right.
You knew everybody. You went to the store, you knew someone there every single time you went. In that relationship and trust building matters more than anything to me. So just being involved, you almost feel like you go out, someone, it more so feels like a family oriented kind of thing rather than just small fish in a big pond kind of thing. You feel more welcomed everywhere. Just a comfort level when you actually know your neighbors and know the businesses you're dealing with, and not just in and out kind of thing.
And being involved can make a big community seem and feel like a small community. I lived for 20 years. I lived in Raleigh after college, and I went back to a Raleigh Chamber of Commerce function literally 16 years after I moved back here, and walked in and saw 3 people that I knew from when I was there.
Yeah.
So even a town as big as Raleigh, it makes that business community small, and I think that's the same here. I've heard it said that relationships are the currency of leadership, and I think trust is the foundation of those relationships. And you don't build that in a day; you build it by getting to know people.
Yep. And I think I think you might have said it a long time ago, and it always stuck with me. Of like, networking isn't just showing up like one time and saying, "Here's my card." It's you just got to keep showing up.
I heard someone at I go back to the Raleigh Chamber, and then we were at a morning networking function, and the guy who ran it said, "Let me explain to you how this works. if you're here today, in 2 days, most people aren't going to remember you were here. If
Hmm.
you come back 2 or 3 times, we'll start to notice that you're here because this is a big group. And if you're still here in 6 months, that's when you start developing relationships. It's not going to
Yeah.
happen overnight. And
Yep.
I think he was right on point. He was maybe a little more blunt than I would have been because he was even more blunt than that. He said,
Yeah.
"Well, that's how we know you're not a flash in the pan."
Yeah.
And but it's true. You don't make friends, become best friends with somebody overnight. And the same is true in a business situation.
Right.
Well, I love for people to share with our listeners things that they can take home and improve themselves. And so, one question related to that is, what is something that you've learned during the course of your career that you wish you had known when you started?
Um, Probably don't spread yourself too thin. Like, be aware of what you're investing yourself
Right.
in. That way you can give more yourself to that instead of a little bit all over the place. Actually be able to give a meaningful contribution to whatever you're getting involved in. Because it's easy, I mean, in the community being involved in someone, it's easy to say yes to everything.
Yes, it is.
But then next thing you know, you're forgetting what is what, or there's just too much going on and it's not valuable for anybody involved. So kind of being more precise, I guess, with more specific with what you're involving yourself in.
And once you've said yes to one volunteer group, they all come looking for you. And
Yeah, it's like
and,
a beacon goes out or something, and
hey, volunteer here.
yeah,
And I think that that's important because if I were in the volunteer group that was inviting you, I would rather you say no than say yes and not be able to follow through with whatever it is.
yeah,
And it's easy to spread yourself too thin. And I've been guilty of it in the past. I've had to learn how to manage that because I want to be involved in everything. That's just me.
yeah,
And I heard a great quote said, you can't do everything, but you can do anything.
yeah.
And
Yep.
I think that's, so I think that's good advice. Pick what you're going to be involved in and focus on it rather than spreading yourself too thin.
And it's hard to accept that you can't do everything.
Right. But
So.
it's hard to accept it, but it's true whether you accept it or
Yeah.
not.
Right.
Well, a similar question, if somebody came to you today and said, I'm interested in being a chiropractor when I grow up, what advice would you give that person?
That you really have to care about people. That to me isn't caring about people is the number one. Like I said, there's a million chiropractors that all do stuff differently and can help people differently. But if you don't care about people, then
Right.
it doesn't matter.
And I think that's good advice, hopefully, in any medical profession or anything that deals with people's wellness or with people's livelihoods in general.
I really think, maybe it's just how I was brought up. But anything at all. Like
Right.
you should care about people and invest in them, and ideally you get that in return too.
And have you ever read, and this is a book that is about 100 years older than you, How to Win Friends and Influence People by
I
Dale
have read
Carnegie?
that book. Yeah.
Yeah, and if you read that book, it's about 200 pages, but what it really boils down to is, give people, view people as valuable, like people, and treat them with value. And the thing I would add is it has to be sincere. If it's not sincere, people will see through it. But you've got to genuinely like and care about people.
Well, it goes back to treat people the way you want to be treated.
Right. Yeah.
That's what we're taught as little kids.
And it's easy to forget that, especially in this day and age when people can hide behind a keyboard and yell and scream at people.
I know. It's people always, so me and my wife we're both big like Christmas time people, and people are like, why do you like Christmas so much? I was like, because it's the time of year when everyone at least tries to be genuinely decent to everybody.
Right.
And I'm like, that's what it should be like all the time. Like, you should be that way and care about others. But like you said, today things are a little different, but
we can change it one person at a time.
yeah.
And, well, to close it out, I like to ask people what they do to either take their mind off of things or to improve themselves. So what kind of either podcasts do you listen to, books do you read, or TV shows do you like to watch?
TV shows, I'm way too obsessed with just about every sport that's out there. So
I could
we
have
always
guessed
joke there's
that.
not a single day where there's not a game on TV that I would sit down and watch. Podcasts go in that same realm of pretty much all the podcasts I listen to revolve around golf one way or another. But like to totally escape, I started a few years ago reading. I used to read strictly nonfiction. I would read everyone's biography under the moon and learn about everybody. Now I read 100% fiction. And I've been reading this one series by C.J. Box, which is also a TV show, the Joe Pickett series of books.
Okay.
But it's kind of like a Western crime, kind of Longmire-esque, I would say. There's like 30-something books in the series, and it's a different event, different crime each book, and it's all fiction, but it's like just a escape, different world, just take my brain away.
Yeah, I'm always intrigued by how people respond to those questions. I've had some people who give you 3 or 4 things that are all related 100% to what they do for a living, podcast or whatever that are. And I interviewed an economist, and all of the podcasts he listens to, I think, were NBA basketball.
Yeah.
Because he says, when I'm listening to a podcast, I don't want to be thinking about economics. I want to take my mind off of it. So it's
No, and it's like I try to do a really good job of when I'm not at work to not be at work.
And that makes sense, because you've got to have. When I first started my business, I was guilty of working 24/7, and I've learned I have to balance that, or I'll burn myself out.
Yeah. Yep.
Of course, that might be good for people like you, because I need to come get adjusted and get massages a lot more often.
Yeah, maybe. But especially now, like with our son, 5.5 months old, that really when I'm not here, he gets all our attention.
And that makes perfect sense. And congratulations on being a new dad, by the way.
Yeah, thank you.
And well, how can people find you if they want to look you up or set an appointment?
So the easiest thing is to call the office. I don't know if you can like attach contact info or anything, but phone number is 910-408-1778. We have a website. You can book appointments through there, coastalhealthnc.com. And then we do have all the social platforms too, YouTube, Facebook, Instagram. And on the socials, the 2 offices are linked together. Okay. So.
And well, thank you, Dr. Paul. And Dr. Paul's last name is Hrvol, Hrvol, in case you're wondering how to spell that. Yep. And we appreciate you being with us today, and we look forward to seeing you in the community soon.
Yeah, awesome. Thanks for having me.